When a person is admitted to the ward, they will have an assessment completed by a nurse and a doctor. And I'm conscious when we even use words like assessment, for some people hearing that, it can almost sound like jargon. So really what we're talking about is sitting down and just trying to understand what are the concerns and worries that the person who's come into hospital has. Once a person has been admitted to hospital, we work with them to develop a care plan. A care plan, in plain language, is just meeting with that person to determine what their needs are and how we're going to help support them to meet their needs and to improve their mental health. When we consider a care plan, the most important thing to communicate is that it's individualised to the person, and it will include the plan of their care whilst they're in hospital. So this will include medication that the person may be prescribed by the medical team, and it will also include activities and groups that the person can attend whilst in hospital. There can be other very individual specific issues. One most important thing is about the person's physical health, because when the person comes into hospital, it's a really good opportunity to make sure that we attend to their physical health. Leaving hospital can be an anxious time for people, so it's really important that there is a discharge planning meeting. Now, in this discharge planning meeting, there will be the professionals who've looked after the person whilst they've been in hospital. So this will include medical staff and nursing staff, psychology and OT staff. The purpose of this meeting is to agree a plan with the person about the follow-up that they will have when they leave hospital. And what we find is that when people do know that, they tend to be far less anxious and more ready to leave hospital and go back to the community. For the people who use our services, when they leave hospital, they will then be connected to community services. And we have a range of community teams who can see that person in their own home, because we know that's where the majority of people who use our services prefer to be seen. And also there's outpatient facilities for people to see community medical staff and nursing staff.